Hey everybody, just got off work, sitting in my backyard. I came across an article today that I thought was pretty interesting and pretty ridiculous all at the same time. It's a local article here in the Central Valley from the Mercury News. In Bakersfield, a woman is suing a hospital because her husband has COVID. He's not doing well, and the wife wants the hospital to administer ivermectin, and they won't do it. And the reason they won't do it is because it's not on their protocol. And it appears from the article, whether it's true or not, that the patient is potentially going to die. Um, in regards to ivermectin, it's interesting. It's a drug that's FDA approved. It's an anti-helminth, basically, to treat parasitic worms. It's been around for a number of years. It was approved sometime in the 90s. It has a pretty good track record in terms of side effects. If you happen to look up the side effect profile, you're going to see a lot of dermatological reactions and some CNS stuff. But if you read carefully, you'll see that that's part of what's known as the Mazzotti reaction, and that happens to be when you treat nematodes. Sometimes they release a bunch of crap into your body, and your immune system jumps all over it, and you get this really nasty reaction, and it can be severe. There's no question about it. However, just the drug itself has a very mild side effect profile. It has mild toxicity. It has a good therapeutic window, and in terms of being used to treat disease, up until about a year and a half ago, if you wanted to use it, there was no problem, and then it became politicized. Now, unfortunately, about every other treatment that's available, ivermectin is, if you want to use it, you're some right-wing nut job. And if you're liberal, if you're a left-wing nut job, then you have to scream at anybody that thinks it's a potential useful therapy for COVID. As I've mentioned before, I think there's nothing off the table for treating COVID at this point. It's a relatively new disease. We're still learning a lot about it. Data that I'm seeing for ivermectin coming out of other countries, not out of the U.S., because the U.S. doesn't want to touch it. The Infectious Disease Society of America released a position statement saying not to use it. The CDC is saying not to use it. All kinds of wacky stuff. But if you go over to other countries, I believe India has used it quite a bit, and some African countries and things like that. So, it's a really sad state of affairs. I know if I contracted COVID and it became serious and there was any chance that I, might not make it or something, I'd want them to give me ivermectin. I'd want them to throw everything under the sun at it. Monoclonal antibodies, throw some zinc at me, throw some azithromycin, throw whatever at me if you actually think I'm going to die from this disease. And it's just a shame that it had to come down to this. I don't know. That's about all I have to say. But in terms of ivermectin, it's just another politicized medication, and it's a real shame. That's all I have for now. Thanks.